good morning, everybody. It's just a little after 10:30, and so I'm going to begin this incredible opportunity that I have as being your Nueces County judge. Every once in a blue moon, I get to come and deliver great news. And the great news that we have today is that this is a press conference for a very historic announcement here in Nueces County, and that's the launching of our behavioral health assessment that we will be conducting countywide. And let me give you a little bit of background, and because I think that once I set the table, you'll understand why all of you were invited here today. The Meadows Mental Health Policy Institute has been engaged by Nueces County Commissioners Court and the Nueces County Hospital District's Board of Managers to perform this countywide mental health care assessment. The study will be a 6-month study, and let me give you the dates. It's going to start now, October 2019 through March 2020. It will be a deep dive into the inpatient and outpatient mental health services that Nueces County presently offers. And of course, we seek to identify those services that are lacking or inadequate. The goal is to evaluate all gaps within the mental health services that are provided by Nueces County and to formulate a comprehensive plan to better train, educate, and implement the use of improved programs and technologies to address all issues on a priority basis. I want to at least say this piece of housekeeping first before I make my personal remarks. Upon conclusion of this press conference, the Meadows Mental Health Policy Institute team will be available for interview opportunities. In addition, I will be as well, and today here with us to celebrate this momentous occasion is another team, and that's the Be Healthly team, also a joint venture between the Nueces County Hospital District Board of Managers and Nueces County Commissioners Court, and they're represented here on the front row by John Camola, Carla Ramirez, and Leon Evans, and they are specifically focused on that piece of behavioral health that is the jail diversion piece of our care here in Nueces County. Also a very important component. You cannot have one without the other when we're talking about behavioral health. They too will be here to answer questions for any members of the press after the conclusion of this conference. So, as people still are gathering and coming in, we welcome all of you here as stakeholders, as friends, as partners, as colleagues. I first want to recognize the 3 commissioners that are joining here in the courtroom with me today, and I'll see them again tomorrow morning. That's Joe A. Gonzalez, Commissioner Jag, Commissioner John Modis, Commissioner Carolyn Vaughn, and representing Commissioner Brent Chesney is his office manager, Alyssa. I am very grateful to Commissioners Court. You see, any initiative with vision requires a team. And the team that we have that sit right behind here are just extraordinary individuals. They're not just extraordinary because of their abilities and their experience and the intellect that they bring to the job. Probably that makes them most extraordinary in my mind is their heart, their compassion to serve the people. And so I'm grateful to you, my colleagues, commissioners, for joining us here today and for helping us launch, as I said, this historic moment. Also joining us here today are other incredible members of the Nueces County team. Some are electeds, some are employees, but they deserve recognition. Walking in is our district attorney, Mark Gonzalez. Mark, I'm grateful for you being here. As you know, when we talk about behavioral health care, we're talking a lot about the criminal justice aspect of behavioral health care, and you are going to be an integral part in the solutions that we are able to implement. Sheriff Hooper is also here with us in the back of the room, and I will tell you, I have had wonderful conversations with the sheriff about our desire jointly to make certain that the largest psychiatric facility is not called the Nueces County Jail. I'm looking forward to our partnership. Just 2 days ago, and this is the kind of relationship we have, I forwarded him an email that I got from another outside agency. Look at this grant, they said. This could really help medical assisted treatments for substance abuse for our inmates. I flip it to our jail diversion team. Great idea. Flip it to the sheriff. Everybody's on board. Within 24 hours, it's in our grants department. We're getting data, resources. Our opioid task force took a look at it, and this is what it means to really be a team of teams. So Let me not exclude all the other partners that we have. Let me congratulate 50 years of service from MHID. I will not be with you guys tomorrow night as you really kick off that celebration, but let me extend on behalf of Commissioners Court our congratulations. And may you be blessed with many more 50-year anniversaries. I'm mindful that we've come a long way. The programming, the deinstitutionalizing, the destigmatizing of behavioral health from places that feel like jails to places that feel like backyard communities. It's with great pleasure that I get to be a part of the legacy of President John Kennedy in my own backyard, making certain that MHID not only is properly funded and resourced, but it has the support of its court. So I want to thank all of you from MHID that are here today. In addition, we have the leadership of our opioid task force. Both our advisory members are here, as well as our chairwoman, Miss Amanda Cutbirth. As we all know, opioids are epidemic levels in overdose across the country, and we are certainly not immune. In fact, it's no bragging rights at all that we are 3 times more likely to have an overdose here in this county than we are in any other county in the state of Texas. In order to make certain that we make the odds more in favor of our citizens, we've put together this task force. Joining us from Bexar County is TJ Mays, who's the chair of the Bexar County Opioid Task Force. In addition, I know I'm leaving those out. I noticed Dr. Sissy Pettis from West Oso Independent School District, a member of the Governor's School Safety Commission, but she also has taken suicide prevention on as a side note of school safety. Members of the Hospital District Board of Managers that are here, thank you. Executive Director Johnny Hipp, so many decades of service. Really, I mean, what can I say? I had the idea, you had the money. No, let me back up. I jest. Come on up, Johnny. Get recognized. You had the idea, and then the idea got shelved in a way. And I always can recognize a good idea when I see it. And that's really what happened, is you and the board really knew where they wanted to go. They just needed a little push. And I think this court now has given you that confidence to exercise your leadership role. And your good financial stewardship has put us in this place. We would not have been able to do it but for that stewardship. And I'm mindful of that. And as I look around the room, I know that you have members of, I see the board, Belle Flores. Welcome, Belle. Thank you, Board of Managers, and I bet we'll have others that'll join us. I didn't recognize Dr. Osbert Blow and his wife, Dr. Nellie Garcia Blow, CEO of Christus Spawn. Our healthcare providers are going to be part of this team. In fact, we cannot do it without them either. So, Senator, I hope I've set the table for what I hope will be the pride for your district senatorially, the pride of South Texas, as we become what we were always meant to be, and that is a center of excellence, not only for healthcare, but for behavioral healthcare, for the treatment of the most vulnerable, our indigent population, and those that are suffering from behavioral health and intellectual disabilities. As I told the team this morning, we all have inspiration. We need not look very far. They're typically in our own families, people that we love with all our hearts, that we would do anything to take the pain away. But all our wishing and hoping is for nothing if we don't have the dollars, the programming behind it. But how do we know what to do? How do we know what to build? How do we know what will work, what will have the right efficacy? Well, I will tell you how we'll know. We will call upon the Meadows Mental Health Policy Institute team at www.texasstateofmind.org. And although I left my phone who knows where, I had written down something last night when I arrived after being in the medical center myself with my daughter, who's my inspiration for this effort. And I don't remember the words exactly, but in general, a strong heart, a strong head is very important. Our will to do good is so instrumental in anything that we undertake. But if our mind is not healthy, nothing works. Nothing makes sense. And so this endeavor is about telling Nueces County, let's figure out what we're doing right, where we are lacking, where these gaps are, and how can we put the pieces together of this puzzle to make it right. And I'm going to tell you something. I'm wearing the 254 here somewhere. 254 reminds me that we are members of one team. That's the Lone Star team. 254 counties in Texas. I venture to say we just came back from the judges conference. All 254 are suffering in the same way. You see, we're not unique. The problem might be unique, but I can tell you something. The way we tackle this issue in Nueces County will be different. By God, we will make a difference. But we need to make certain that we implement the right strategists, the right team, the right experts to put together the right resources for us. And so, without further ado, please help me welcome John Petrilla, Executive Vice President of Policy for the very famed Meadows Mental Health Policy Institute. We really are thrilled that you are here. We thank you, and we would ask that you introduce your team and take us through your slides. Thank you. Thank you.
Thank you, Judge, and it's a great pleasure to be here, and thank all of you for coming. My name is John Petrilla, as the Judge said. I'm in charge of our policy efforts, particularly in the adult area. I think, Judge, with your permission, I'll introduce our team at the end, if that's all right. Senator, thank you for coming. I will say to this group, as I've said to many groups around Texas, there's no state legislature in the country that's done as much for mental health in the last 3 sessions as the Texas legislature has done. In a time where funding, generally speaking, has been cut across the country, the Texas legislature has made remarkable strides, not only in investment, but with some of the legislation this last time that I think will be instrumental in linking the university here to pediatric and other practice, in helping transform through match programs like Senate Bill 292, what's available to communities for focusing on justice-related issues. And so, Senator, thank you and your colleagues for that. And thank all of you for from the County Commission for being here, health leaders and other folks. I'll talk a bit. This is going to be a wonky few slides because you're giving us money to do this. And so I think we are obligated, and you have the right to know how we will approach this work. So this will be a bit wonky, but I want you to understand what we're after. We'll introduce our team later. I'm going to talk about the deliverables, the timeline, and our approach. And I want to be very clear about a couple of sort of perspectives we will bring to this work. Before I say that, though, this is the time to be having this conversation. I've been in this field since right after the American Civil War. I got into it at the University of Virginia, so it goes back. I was forensic director in Missouri in the late 1970s. I was the general counsel of the mental health department in New York during the age of deinstitutionalization, the emergence of AIDS, crack, and other sort of things. And one thing that always marked these issues historically was that mental health sort of sat on the side. We took a segregated approach to it. It was not integrated with general health. It's the only field, no one has ever said about cancer, the largest cancer institution in the state, the community, the country is the jail. The only place we've ever said that, the only disease we've ever said that about is mental illness. And so what's changed is the ability to have these conversations. So Judge, thank you for your leadership and your colleagues on the commission for this and from the community more generally. There's no better time. This conversation would not have occurred 10 years ago, would not have been thought of 20 years ago. And even 5 years ago, the tools I don't think existed. And now, in part because of the effort of the legislature, there's tools in place for the community that simply sort of demand to be taken advantage of. So those are great opportunities there. So let me start with a bit about the Meadows Mental Health Policy Institute. We're 5 years old. We are largely the product of philanthropy and other funding. We are determinedly nonpartisan. We are devoted to using data to drive our work. We are wonks for this stuff. And we will try in the context of this assessment, as we've done all over the state where we've done work, to not just give you our opinion, but we will try to, if we make a recommendation, back it up with data, with evidence. If we don't have the evidence or the evidence is thin, we will tell you that, but we are nonpartisan. We do have a point of view about a couple of things that I'll talk about in a minute, but we work closely. We've had the good fortune and privilege to work closely when requested with legislative staff and with members. We worked, for example, I led our work on the working with Dell Medical School and UT San Antonio on the state hospital redesign work, which was a multi-county sort of effort. And then we work in local communities. And the idea that motivated the Meadows Foundation when it created the Institute was that if you can influence state policy, you can only do so by knowing what's happening in local communities, because where the action occurs is local. But if you have the opportunity to work with the state, you can help frame opportunities for localities. So our mission really focuses on local communities, but also state legislative and regulatory framework as well. And so that's sort of the basic kind of focus for the twin focus of our work. We've worked all over the state. This is just some examples of work we've done. It's a wonderful state to do work in because it's a diverse state. It's kind of a large state. I came from Florida to the Meadows Policy Institute and was bragging about having worked with 26 counties, and people scoffed and laughed at me and said, really, that's hardly impressive at all, given that 26 counties just buys you like a trip from Dallas for a couple hours. So we've worked all over the state. We've worked in smaller communities. We've worked in large communities. I have a preference personally from work I've done in other parts of the country as well as Texas for communities of this size, and one because a community this size has an infrastructure that's large enough and resources to do something with, but it's small enough that you don't have the multiple political layers and sort of the vertical arrangements that you have in larger places. So county commissioners come to a meeting like this. There's larger cities where the county commissioner would send a staff person, where you can talk to a mayor in some communities. So we are delighted to be here particularly, and also being near the water is not so bad either. So we've done work in various places. We are devoted to trying to make any recommendations or any findings we make local. This is not sort of an off-the-shelf where here's the 10 things we will tell you, which are the same things we told Abilene, which are the same things we told Waco. We don't live here, you folks do. And so for us to come in and just say, well, here's 8 things you should do or 10 things really is kind of silly. And it's a waste of your resources, and it doesn't do any good in terms of the goals the judge and other folks here are after. So we are devoted to giving you sort of operational recommendations at the end of this that are based on local realities, because local systems vary, as all of you know. This is the bias I will declare that we do have as an institute. The bias is that we have got to end sort of this segregated treatment of mental illness. Now that sounds it may sound sort of trite to some of you. It may sound sort of we're already doing that. But in fact, we don't. Because we don't with appendicitis, we don't with diabetes, we don't with cancer, heart attacks, rely on law enforcement to make what are often clinical judgments about what should happen at the point of crisis. And we tend in other diseases to try to focus on prevention, explicitly and increasingly. And we're kind of new to that with mental illness. And so if we have a bias, it's that we need as much as possible, and it takes time, but to try to integrate local responses to mental health crises within the general health system. And again, a good bit of what the legislature has done in the last 3 sessions is create tools to do that. The legislation in Senate Bill 10 or 11, whichever finally it ultimately became with the magic you all worked at the end, is a wonderful tool for linking sort of psychiatric resources and telehealth to pediatric care. That fundamentally changes sort of the approach to assessment of mental illness among kids, because it acknowledges mental illness as a disease and not something separate that we deal with in a totally separate system. So this is our current mental health system, which is quite different from the general health system. And our goal, and again, I think if we have a bias, we should just declare it, and our bias is that within what the local sort of conditions permit, over a time period that local realities sort of have to acknowledge, that we try to shift as much as possible identification of mental illness, response to crises, short-term care, long-term care, that we try to do that as much as possible within a general health framework. And there's ways to do that. We don't have a single model for doing that, but that's kind of our bias. And if you want to talk some more about what that means, we can. But again, I just go back to the statement that we have never declared the jail the largest provider of healthcare services for any other disease except mental illness. And that's just crazy. And we also have done analyses, and we'll do this analysis here, in the context of the state hospital work, where we look between those two state hospitals at about sort of hospitalization practices in about 110 counties. It's astonishing how many people for first episode of mental illness are transported hours and hours and hours away. Now, we do that sometimes, right? So if you want the best cancer treatment in the world, you go to MD Anderson. But we don't do it routinely. We don't routinely transport people who evidence a disease hours and hours away from their homes, particularly with children, where we detach them from their families for what are often short-term stays. So again, our whole kind of frame of reference, what we'll try to illustrate here is sort of some of the movement of people across what are sometimes vast geographic areas. And there's lots of reasons for that. It's not an easy fix. But again, it's just sort of a different kind of approach to treatment that we typically adopt in other sort of things. So this is our primary deliverable, a comprehensive needs assessment. I won't read this, but we will focus on substance use disorders as well. And we'll focus on substance use disorder as a secondary, but also primary diagnosis. We'll look at prevalence, comorbid conditions, provider capacity, et cetera, et cetera. And so this will be a deep dive. In Lubbock, we interviewed, I think, 192 people. Most of you we will ask to talk to you in one way or another. And folks not only primarily interested or primarily devoted to treatment of mental illness, but folks for whom it's a secondary mission or third mission. The school systems play a vast role in this. We've done a lot of work with school systems, and we will do a lot of talking with the school districts here. We're all familiar now with the pipeline from, sort of behavioral issues in school to the juvenile justice system, the adult system. In the context of Harvey, we did a lot of work with the school systems affected by that, sort of the impact of catastrophic events on children, the impact of things like school shooting drills on children. So we'll do a dive into that. And so this will be an immersive experience. You'll get to know many of us maybe more than you would like to. And then we'll look at subpopulations. Our team includes experts in veterans, and the two folks here who I'll introduce in a moment are both veterans themselves, have extensive experience overseas. We've got folks expert in schools. We have a former assistant chief of the Dallas Police Force who has joined us. So we try to bring as much expertise. This is a senior team. It's not, as you can tell, it's a very senior team. And so we will do a deep dive into multiple kind of populations and issues. The timeline, this is the kickoff. We will submit, this is a bit, will have to be pushed up a bit, Judge, as you said. Part of this is we've changed the timeline a bit to accommodate both a report but then some post-report work with you all after that. So we'll come back to that. We look at prevalence data, estimates the first episode. I'll show you just an example in a moment. We've looked at one of the interesting things across the state, and this again became an issue in the state hospital work. There's lots of community hospitals that license beds for psychiatry but then don't use them. And again, one of the things the legislature did was appropriate some more funding to permit communities to buy acute care psychiatric beds in some efforts. So one of the things we will map for you is sort of how many folks from this county are hospitalized for inpatient care for psychiatry by age. So where does that occur? How many folks come here from out of county into this community? You've got a big children's hospital here, so there's a lot of migration in. And so we'll track all that, and then also sort of what capacity exists in the world around you. Because while beds aren't everything, they are part of this, and rationalizing how we use psychiatric hospitalization becomes an important part of sort of an effort like this as well. We'll look at, again, substance use, hospitalization. We'll do a deep dive into how many folks end up in the emergency room here, and then sort of where do folks go. So it may be that everyone who goes to the emergency room here, if they're hospitalized, is hospitalized here. In a lot of communities, that's not the case. And so sort of what's the arrangements and what happens between when police have to navigate somebody. And that's been a big part of the work in Bexar County, is trying to rationalize the front-end navigation system. And so we'll be looking at that as well. It's important in something like this to have a chart that nobody can read because it's too small. I want to point out a couple things here. One is, so we'll give you prevalence numbers, but sort of inside big numbers, smaller numbers that matter. So this was in Travis County. We estimated for first episode psychosis, right? First time psychosis manifests, about 200 folks a year. That's a manageable number, and we'll give you a similar estimate for here, and the estimates may be off by 5 people or 6, but they're not off by 1,000. One of the points, I think this gets to a message of hope, these are manageable issues. Even in under-resourced, fragmented systems, we're not talking about millions of people here. In fact, there are fewer cases of first episode psychosis by far in Texas each year than there are first cases of cancer. And we try to, breast cancer, and so we try to reach anyone, right? Identify somebody quickly, treat somebody with breast cancer. And we don't think twice about making that our goal. We're going to treat all breast cancer. We're going to identify it. We're going to treat it before it gets worse. The numbers of folks who become psychotic in a year in Texas are far fewer than that. And yet, on average, people don't get treatment until 7 years after the first manifestation of psychosis for a lot of reasons, right? But the impact of that, as all of you know who deal with this, there's literally sort of impact on the brain. There's impact on family structure and family life. There's impact on a family's finances. And so we will try to show you places where you can intervene sooner, but always with this message that the numbers, the place to start are with smaller numbers. So there may be X 100,000 people with mental illness in this county. It doesn't mean that that's the goal, right? So where can you start, and how do you get traction to create more hope from this kind of initial foray? Number of deaths by suicide, the big issue, right? The numbers of suicides are going up. Depression is a big part of that, anxiety. In Travis County, there were 143 suicides in the year we did this for the state hospital work. It's a big number, it's an important number, but it's a manageable number, right, if we organize ourselves to kind of reach those kids early. The other thing we will do here is look closely at the relationship between physical health conditions and psychiatric conditions and substance use. It's been known for some time now that somebody with diabetes or somebody with cardiovascular condition who has major depression as another diagnosis, that the cost of their care over time will run 3 to 8 times more than the cost of somebody with diabetes or cardiovascular who doesn't have major depression. So we found it increasingly important to look at which physical health, and we'll look at all the diagnoses. The other thing, this came up last night at dinner, we have databases available that hospital systems report to that we're not going to be asking the hospitals here for proprietary data. We buy this big database that all hospitals report to, and we use that as the basis for this. Then we try to cross-check what we found with the hospitals. The argument that the data are inaccurate isn't persuasive if you're actually the one reporting it, but that's a different sort of issue. We've had that in other places. But we'll work with folks on what that is. We're not going to be asking people for proprietary data. But when we looked at primary health diagnoses associated with psychiatric diagnoses, this again is from Lubbock, 256 folks with sepsis and so part of the reason this gets to then is where do you treat folks? So if you're asking a jail to be a primary provider of psych care, even for a short period of time, and somebody's got complex physical health conditions, that's a burden on the jail that is unfair to ask the jail to assume. And so we'll give you a lot of information on comorbid health conditions. This is just secondary health diagnoses. So for example, 17% of all people admitted to inpatient psych beds from the Lubbock area were also diagnosed with hypertension, 7% with asthma. So part of this is we got to be able to deal with both issues. And again, it's another part of the argument for treating mental illness as a health condition that is often aligned with and comorbid with lots of serious physical health conditions. So we'll be looking at that as well. We'll do interviews, as I said. We'll interview lots of you. Focus groups where necessary, we'll ask you for a lot of documents. We will try to organize ourselves so we have a single person on our group asking a single person here for documents, so we're not flooding you with document requests. Easy for me to say as a lawyer, right, having conducted discovery in the past and just give you a subpoena for everybody, but I don't think that works so well here when we're trying to do this cooperatively. So we'll do that. And that's kind of our approach. What we will give you in the end is we will create an iterative process so folks here have an opportunity to review early findings. And what we've typically done is given you a draft report with everything marked draft, asked to meet with a group of core stakeholders, ask for reactions verbally and in writing, make amendments, show you what we change in response to that, eventually get to a final report with things that are actionable. We're not interested in just giving you hopefully some vague, you should do better than you do. We are also, this is not designed to say that didn't go well or whatever. We're actually trying to work cooperatively with you to understand, always mindful, we don't live here. And so we need to test any inferences that we draw, any conclusions we reach with folks who are here locally to sort of, does this have face validity? Does this make sense? Or is this just wrong? And so we're devoted to the maximum degree to getting facts correct, drawing inferences that are reasonable, and to giving you steps that you can take that are operational and that assume that this is something that will take a long time to do, but that the more traction you get, the more likely it makes that you can sustain it over time. So let me just real quickly introduce our team. Marilyn Headley, who is our program manager, who will be responsible for keeping all of us organized, and has had a lot of experience in public health, did an internship with us, worked with the city of Dallas for a year on their legislative stuff, and found that we were more fun, with all due respect to the city of Dallas. Paul Stokes, former assistant commissioner of the Dallas Police Department, a former Marine, somebody 34 years, Paul, in the Dallas Police Department, 31. And so when Paul retired, we grabbed him because he's been instrumental in helping us understand the front end of systems. Kyle Mitchell, who will be leading this project in many ways. Kyle is a veteran, has run our veterans team from its inception, is now running sort of an integrated adult veterans team, and is vastly experienced and has worked all over the state and was deputy commissioner, secretary, and so has a lot of experience. And given the conversation, Judge, we were having about the size of the veterans population here, Aaron Smith, who's also on our veterans team, but also understands sort of the front end of these systems. Medical corpsman, Aaron, correct, for 2 tours? Is that right? So, and again, so Aaron is there. Melissa Rowan, who has worked with mental health centers and health systems all over the state and country and has just joined us recently and who will be doing a lot of work, knows folks here already. And so we brought the best team we can. We know Leon and his folks and look forward to the opportunity to work collaboratively with them as well. So I will stop at that point, and if there's questions. Oh, Phil Ritter, who was introduced, right. Cardinal Ritter. Phil, who's our Chief Operating Officer, the first or second employee of the Meadows Mental Health Policy Institute. One of the things we would like to do, Phil's leading a big initiative with employers, trying to help them, and a lot of employers are interested because of impact on work productivity and workforce issues, trying to create strategies that move beyond EAPs, particularly with depression is sort of a major driver of that. I mean, many of you know this, but depression is in terms of World Health Organization rankings of burden of disease, depression is number 1. And so Phil's leading our efforts there and a lot of our development work. And so one of the things we would hope to be able to work with you all on are there funding opportunities that we could help sort of to implement whatever it is you all decide to do. And we've done that in other communities around the state. So Judge, thank you very much.
John, thank you so much. That was very comprehensive, and as I said, they're going to be available after the press conference. Let me just, when you sit down, you realize who you forgot. And I wanted to, as we talk about partnerships, I want to acknowledge Congressman Michael Cloud's office, Luis Buentello. Thank you for being here, Luis. I know we're going to be able to count on you all for federal partnerships as well, as this problem has been addressed by Congress and continues to be. Also, I want to thank the the Most Reverend Bishop Mulvey for sending members of the diocese here with us. The Catholic Diocese and its social ministry is tackling a lot of the same issues that we seek to tackle. And so whether it is with governmental entities, whether it is with stakeholders who are experts in the field of behavioral health care, law enforcement, our judiciary, or our interfaith community, it's going to take all of us in order to make this work. So with that, let me close with the best way I possibly know how, and that's to invite a great friend and a great champion for all the issues that affect the folks of South Texas. That's my friend, Senator Juan Chuy Hinojosa, to make final remarks.
Thank you, Barbara. I'm here, I really have to commend Judge Barbara Canales for leadership and the county commissioners. They're so proactive in focusing on the issues and the needs that we have here in Nueces County. It's really amazing. It's really exciting. And then to have the Meadows Mental Health Policy Institute. Mr. Petrilla, there was an excellent presentation on how the assessment will proceed to identify those gaps. And the hospital district, Johnny Hipp, I think they play a very important role in healthcare. And one of the things for us at the state level, we started to focus on mental health. This last session alone, we appropriated about $8 billion, capital B, $billion for just mental health across the various agencies. But we also focus on our students. We created a mental health consortium, appropriated $100 million to help our schools identify those students who had mental health issues, who were suicidal, could hurt themselves, and provide and intervene at a very early age. So we're very focused on this. And we also opened up 1,600 new slots for persons with intellectual disabilities, trying to provide better community-based services. And we'll focus also on psychiatric beds. We increased funding by $29 million and created 50 more. Plus our state hospitals, they're so important. We appropriated $425 million to increase capacity. And we also appropriated $59 billion to increase community mental health capacity services across the state. So for us as a state, we're looking for partners, people we can work with. And Nueces County is taking the lead in the whole state of Texas. And for us, it takes teamwork. We can appropriate the money and help out, but at the end of the day, it's a local community that has to step up and deal with this very serious issue that we have. And you're right, in the past, John, we have used our jail system, unfortunately, to put people in jail, people that shouldn't be there, where they needed mental health services and have to be incarcerated. So we very much focus on that. And I'm very excited to be here today with my good friend Barbara Canales and the whole Commissioner's Court. It's a new day here, and we intend to do our fair share working with the leadership here in Nueces County and all the agencies and people that work to try to focus on mental health. Mental health that have been endured for so many years is now at the forefront of our agenda. Thank you all very much, and thank you again, Judge Canales, for your leadership, and God bless you all.
Well, this concludes our press conference, and just remember, it's all about a strong mind, strong body, and a strong heart. So thank you again, and please, I really do want to invite you to ask questions. If there is a question that anybody has that would like to be addressed at this time, feel free to speak up. Hearing none, as we say, we're going to be adjourned, and we'll meet outside for interviews. Actually, just caught eyes on interim chair of the Hospital District Board of Managers, John Martinez, formerly a county court at law judge here in Nueces County, and actually did the mental health court. I'm grateful for your service on the hospital board, but more importantly, thank you for taking a leadership role last night and welcoming our guests here to Nueces County. So thank you, and we will see you outside. Thank you.